So tobacco has been around for centuries, but what we know about the health damage is that people who smoke are liable to die young, more than about 10 years earlier than, people who don't smoke, which is a fact. Okay, because there's been research that has been done on that one. So tobacco smoking is the single most important cause of preventable and premature death globally. The World Health Organization estimates that tobacco kills nearly 7 million people annually. Like every year, about 7 million people die because of tobacco, which is a very scary number. And 100 million deaths were recorded over the course of the 20th century. Now, more than 6 million of those deaths are the result of direct tobacco use, while close to 900,000 deaths are the result of non-smokers that were being exposed to secondhand smoking. So even if you don't smoke, if you stand close or you're a friend of someone who smokes, or you are always in a round table with someone who smokes, then you're also perceiving it. And about 900,000 have died because of that particular situation. So unless urgent action is taken, the annual death toll, according to WHO, would rise to more than 8 million people in 2030, which is a scary number. Now, close to 80% of world's 1 billion smokers live in low to middle income countries like Nigeria. Which is a scary thing. You already don't even have money to take care of your health, and you're smoking to kill your intestine. We're talking about the lungs, the kidney, which is affected from this kind of thing. So it is really scary how people, even with this knowledge out there, people are still smoking a large number. Fatima, don't you think this is the most, it's like someone knows what will kill them, but they tend to get, I don't care, at the end of the day, I'm going to die. But you don't know how long you were going to live
like
before.
You said, it kills, and they know, because it's written boldly on the packs too, that, smokers are liable to die young. But then people still take it, and I'm still wondering why, because one way or the other, people have actually lost their loved ones due to smoking. Indeed. Of whatsoever kind that Indeed. It may be. It's not just the tobacco. There are other brands of smokes that are coming out, like the shisha, the vape, whatever it is they call, and so many more. And they have more of all this whatever that causes the cancer, and
yes.
all the yes. But then people still go ahead to do it, and they'll tell you, I'm taking a lot of water, or I'm taking this. How I don't know how that can actually help save or change anything. So yeah,
it is the most scary thing. Now, smoking is something that, whether we like it or not, it is not really good for our health, but people are smoking it. So right now we want to talk about how to stop, how to find a solution, how to find ways to make sure people, or the younger generation growing, don't take these things into make these things habits, because it's gone to a point where we see there is this new containers being made and being sold in places where even students can get their hands on, and you see a child taking something like an inhaler, and that thing includes it brings out smoke and all that. So these kind of things also have tobacco in them, and it's a really scary situation. So right now we want to talk about what are the reasons why people are ignoring all these statistics and still smoking, and how to find that possible solutions in order not to grow up and having a weaker generation. One thing that Nigeria is already boasting of is the fact that we have the capacity, we have the labor, right? So when now these people are smokers and they're becoming weak, then how will this help the country? It wouldn't. So we are going to open the phone line. The phone line will be displayed on your TV screen. You can also send us WhatsApp messages, just in case for you to be able to discuss what is happening, about this particular situation. But anyways, let's take a quick break, and then when we come back, of course, we will open the phone line to hear from you. So don't go anywhere. We'll be right back.
Are you interested in the latest news and developments in Nigerian politics, policy, governance, and other critical national issues? Look no further than Daily Politics on Trust TV. Our panel of experts and key people in government provide in-depth analysis and commentary on the biggest stories in Nigerian politics.
And 33.3 million Nigerians are suffering from multidimensional poverty. It's a much calmer Buhari than the Buhari who was in the khaki uniform.
Naira to Naira X rate is higher anywhere in the world. The Naira is higher than dollar exchange rate. So you want to...
Since central bank governor you're doing, you must do it fast. Number of casualties we have had, we shouldn't have had. Security, as far as Nigeria is concerned, we have wronged.
From the inner workings of government to the latest on legislation, rule of law, implementation and democracy, we have you covered. Don't miss out on the latest political news and discussion. Tune in to Daily Politics, weekdays on Trust TV, your source for reliable and unbiased coverage of Nigerian politics.
Welcome back to Daybreak Extra on Trust Television, and right now we'll be talking about, like I said before the break, smoking addiction, the effects and challenges. Why are people so addicted to smoking? To a point that even though they know that it is a fact that they are liable to die young, I mean, let's not forget the diseases that even when you start facing health challenges, it will definitely affect you. They are still taking it. So what will be the possible solutions? The number that you get to call is displayed on your screen, and you can send messages for those of you who maybe cannot get through to us, or will prefer text message. You can send us rather via WhatsApp. Send your messages, and make sure if you're sending your message, you include your name and location, so that we'll get to know what, of course, your thoughts is, your take is on the challenges and the possible solutions of this smoking addiction, which is a really scary thing, Fatima. A lot of people are acting as though this is fine, and somebody will say, yes, I have a friend who smokes, but that person cannot tell me or convince me or influence me to smoke as well. But the most scary thing right now is it's saying, based on statistics, that about 900,000 people that die are people who are second-hand. They're just in the vicinity. Maybe you're sitting with a friend and that friend is smoking, and you inhale it and you make it constant. Then because it gets you.
I'm actually yet to still understand. When you're in a room with people maybe smoking, like you said, and you inhale, it affects you even more than the person that is smoking.
Indeed. So
I'm still yet to understand how this really happens. But then, in whatever situation, is still almost everything is actually bad. They say too much of food too can actually cause some side effects. So I feel, but smoking is actually is a no-no for me. Like I said earlier, one way or the other, we must have lost a loved one due to smoking or something. And like some of the diseases it causes, tuberculosis. I think smoking causes that. So yeah. And it becomes cancerous. You wouldn't want to put all this burden on your family, because when you're smoking, an organ will definitely be damaged.
Yes, it will definitely be damaged, and it will leave you sick. It will leave you in a position where you cannot even cater for yourself or even your family, which is something we have come to see. We've seen people who smoke, no matter how rich you think you are, because someone would tell you, would justify what they're doing and say that, okay, yes, I take it, but I eat good food and I do this. But then no matter what, the pressure you keep putting on these organs in your body would definitely come back to haunt you. So it is one of the most scariest
because
things.
you know the experience is actually really not nice, because I've seen it happen, you know, a couple of years ago when I think we went to visit a hospital, and then we saw someone that came and was vomiting blood, and it was because it has reached that stage that I think there was nothing they could do. And you could see some signs, you know, if you smoke, if it's becoming too serious, you could see signs even in your body. Your maybe face will change, your fingers, your, you know, things will actually change to show you that, okay, it's becoming too much. I mean, not to, you know, criticize or, you know, say something bad, but look at Snoop Dogg, for example. You know, his recent post, he came out to say, oh, he has stopped smoking. And we all know that he's a chronic smoker, right?
Snoop Dogg turned everything to joke.
Are you kidding?
Yes, it turned out that he was joking, and people felt offended with what
I was actually really happy, you know, when he said he has stopped smoking. We were actually thinking maybe there were some health implications and stuff, but then, hey,
it turned out that it was an advert that he was doing for something, and he made it like that, and a lot of people came out and were so disappointed.
But then you use your family saying that, oh, we have come after
people
that with my
like,
family,
we have come to that,
you know.
Why would you even say that? You're somebody.
You have a huge views from your followers, and they look up to you. So
exactly. Yeah. So it's always good for you to use your platform and make sure you find a way to you know, find the solutions to this particular position. And whether we like it or not, there are influences that you have that would definitely impact. You could use the influence, and hence the reason why we are talking about you know, smoking. What are the causes? How to find the solution. So please go ahead, call the number on your screen to share your thoughts on what is happening, you know, in terms what is the problem, why are people still smoking, and what should be the final solutions to these situations. And if you even have had any experience, in order to share with us about someone close to you that have gone through situations like that. Because personally, I had a bad situation of having watched someone that I know, you know, go through a situation like this, which is a really scary thing, you know, to do. We sit down and we see people doing these things, and it is the most scary thing. Like, why would you even put yourself in that position? The addiction it's there. It is the most scary thing.
And you know,
you start
addicted to something, you can't leave it. Okay, we have a caller. Hello, good morning.
Morning, how are you?
We're fine, thank you.
Your name and location, please.
My name is Hudu M. Kaujo from Jamaa Local Government, Kaduna.
Sorry, please, can you speak a bit louder?
Now, my name is Hudu M. Kaujo.
Oh, okay. Hudu, thank you for joining us. So go ahead with your thoughts.
Really, I want to talk about concerning the issue of Kaduna verdict.
About the issue of what?
Kaduna State verdict.
Okay.
Kaduna what?
Kaduna State.
Okay.
I want to talk about it.
Okay. In terms of smoking, right?
In terms of Kaduna Ubasani.
Okay, so we're actually discussing smoking, how bad it is, its effects and challenges.
Challenges for what? I think I just opened this in my TV set. I don't know what you're talking about.
So the topic that you are seeing there is what we are talking about, smoking addiction. I want to hear your...
Okay, I'm sorry. No, really, but my advice is to federal government to put ahead to see that all this smoking should be stopped, because it's a dangerous thing.
Okay.
Really,
all right.
That's my advice.
Okay,
thank you.
Thank you so much, Hudu, for that. So we're talking about the smoking addiction, the effects and the challenges, that people go through, and how you can help your loved one at the earliest to curb out that particular issues, because when it gets too much, we know how hazardous it is to someone's health. So please do share your thoughts on our WhatsApp. Let's get to read from
already,
you know,
Sumaya.
of course, what your thoughts as. Yes, so it would be a great thing to, you know, work out these situations. I know it has become close to normal for people to smoke in Nigeria, but it is the most scariest thing. The younger generation now are picking it up as a habit. And before you know it, a habit becomes something that would definitely put you in a bad situation. So,
and you know, I think a couple of years ago, if I'm not mistaken, the government actually made it banned smoking in public, right? Like if you're caught smoking, it's either you pay a fine or you'll be jailed or something like that. There was a time that was actually happening, so that the younger generation or the young people, you know, on the street seeing these things becoming a habit, they could actually pick from it as well. So I think if the government can still bring back that, it will actually help. Maybe people will start hiding to smoke.
All right, we do have another caller there. Good morning.
Yeah, morning.
Yes, your name and location, please.
Abbas, Damarama.
Okay, Abbas. Where are you calling from, Abbas? Okay. Thank you so much for joining us, Abbas, on that one. So go ahead with your thoughts, please.
Yes, I have a friend who is smoking for the past 40 years that I've known him. And he's still smoking. He can't take advice from any quarters. So I don't know what you are going to highlight to advise him, because he's also listening.
Okay, no, we're trying to find a solution to these things.
We are asking of the challenges people actually face and how it affects them, like the after effects of smoking. So what do you think can be done to change that? What advice? Okay, I think
yes, we lost that one.
The funny thing is, you know, even women actually smoke.
Of course.
I don't like that fact.
Why is it? I mean, the last time I said...
Why are you laughing?
The last time I said that women are not as strong as men when it comes to strength, you almost got offended, like you're coming...
No, but I said it. I said
right now,
actually can
women are matching up to the energy of smoking.
There are some women that beat men. I said it. I said there are some women that beat men, but then I don't like
it. It is of course, it's not a good. I mean,
we have another caller.
Good morning. Oh, we lost that call. Please go ahead, keep trying us. I think the network is bad, but yes, you get to connect with us. We get to hear from you on this particular issue. I mean, it's something that is, biting us hard in the society, and we need to find possible solutions in order to make sure we curb this thing before it gets to, a whole different level. Now, tobacco is something that we need to avoid. It is hazardous. And one thing about this thing is that it's a natural additive. You know, you get addicted to it. So the moment you start as a test, then you start finding yourself going back to that thing over and over again. And before you know it, you're trying to find a way to get out of it, but it's already too late. You're hooked on it. And it starts, ruining your liver, your kidney, and all this kind of things. So definitely, these are things that we definitely need to address in our society and find a way to curb it. It's really a sad situation. But Fatima, have you ever, had someone around you go through that thing? It is the most scariest thing.
I have, actually, and it's a very, very special someone that I don't want to actually talk about. But it was a tough one, because you wouldn't have known that that is going to be the cause of their death.
Indeed.
Or is going to make them vulnerable, to, like I said, put a burden on the family to raise you, put you down here, take you to this place or that place. When you think of the stress your family are going to go through after you take all this, I think that's enough for you to just, drop it. Like I said, everything. Okay, we have another caller. Good morning. Hello, good morning.
Hello, good morning.
Morning. Please, your name and your location, please.
I'm confinement from Kogi State, the Kina local government.
Okay, I'm from Kogi. Please go ahead.
So my contribution to this is this. Nigerian has been so much eager on smoking, anything at all. It's not even only tobacco or something of that nature. But now the solution will lie in the hands of our government. It's only our government that will say this, at least to bring it to at least 40% or 10%, which will be acceptable. How are they going to do it? All that energy which they are channeling towards all these contraband goods, rice, all these things and all that, let them at least say, okay, this cigarette, we are not going to totally ban it because of the relationship between the Nigeria country and the producer. But let's minimize it and say at least one truck of this smoke will enter this country in a month. Apart from this one truck, no one will enter. So every month, if you even have your money, you go to store, then say that cigarette is not around. You can't kill yourself, you will go. Another day, if you go, they say, oh, you remain one pieces. You will take the one pieces, and then you go. Another day, if you go, they say there's no one, it's not there. You will go. Imagine that these people will still see the drawing in the graphics in the packet of that smoke, and they still went ahead, buy it a packet, and they still taking the packet. And they have always stated down to you that you taking this, you are committing a suicide. You still take it, still smoke, and make sure that you consume a packet in a day. Please, that is the only way I think that our country can be reduced by making sure that they regulate how many trucks that came in a month or in a year. If they can't do it like that, I don't think that is a solution. Let them do it like that, so there will be a scarcity of smoking, of tobacco in the country. That was my suggestion, please.
Thank you so much for that contribution. A very smart one.
I think, yeah, you know, when there's limited access, you know, when it's not in circulation, I think the people will definitely look for. But then let's not forget the ones that still chew. You know, the people, this one,
they all come in different forms.
Yeah. So even if they'll smoke this one, the cigar will not come in, they will still find another means to.
And there are ones that we saw even in sweets. You know, people are making sweets now of these particular things, and it's really scary how they are finding different ways of these things. I mean, we're scared of now kids.
And then let's not forget that Nigerians are actually very smart. You know, once they see something and they see what they will go ahead and start producing themselves. You know, they won't have to wait for. So I think there's going to be a whole lot of, you know, intervention from the government to limit the access to the, maybe like Abba said, production of tobacco within the country or even outside the country as well, because these people, you know, they come in to invest. Sometimes it's not just about importing from, you know, outside other places. So yeah, you were asking me earlier and I was saying that there was someone that I actually know that has gone through should I say trauma, or should I say a breakup or something, and they became addicted to smoking. And you know, there are some people that become foodies too. That's why when I said too much of everything, you know, when seriously you eat and overeat and eat and you overweight, right? So it's everything. If you too much of everything is actually bad. So when you take even water, there are sometimes that you tell you take this liter of water in a day, but when you exceed, it becomes a problem for your organs as well. So everything is bad in whatever way you try to, you know, take it.
At this point, yeah, there is that fear because we're not even pushing for moderation. I mean, this is something that is bad. So even when we tell you, no, don't take it too much, it's still bad. But we have gotten to a point that there is so many addicts in the country on tobacco, and it's one of the most scariest thing ever. So right now we're trying to figure out possible solutions on how to curb this. And the last caller actually gave us thoughts on how he think this thing could be curbed, where the demand of federal government to at least put a stop or put a limit to the number of these things that would come in. But then the federal government are already gaining a lot from taxes. You know, if you're bringing this load of things, there is almost the tax that you get from this. And the intake level in Nigeria is super high. So that would be another great loss for the federal government. But it would be good for our labor, which is, you know, it's all about the children now. Where you see someone at the age of 40 looking really drained and scary. And there is a lot of things, you know, happening that at the end of the day, you're really scared on what to talk about. So it is really a scary situation. I mean, we're seeing your messages, so yes, messages are coming in. We're definitely going to read out these messages in order to you know, hear from you. We appreciate those of you that are typing. We are seeing a lot of detailed analysis or thoughts on this matter. And this is something that definitely we need to find a solution on. I don't know how much we're going to emphasize on how bad this is for our health. And we are this country that we keep bragging about. Nigeria is the most popular country. And based on predictions and research that has been done, it says in 2050, Nigeria would be one of the most large economy. We're talking about, based on numbers, the population will be about, I think, top 3 or top 10.
Yeah. We're increasing by
yes, we're increasing. So first of all, it's not a fear of an economy that is large. It is a good thing. So that means that the governments and the people can put these people to use in order to create a very large and productive and a very developed country, which is where we are hoping to head, you know, at that particular period in that year. So this we cannot have unhealthy youths, unhealthy labor that we're supposed to put in order to generate good things. We've seen people just slump and die, and then it's because of addiction.
And you know, the funny thing is, there are some clerics that actually even, you know, preach about all this you know, smoking and what have you. But then you'll be wondering the number of youths that smoke these days is actually really high.
It is
like
high.
I said, it's even women. That's what, you know. I feel there are certain things that women shouldn't try, because, you know, you want to get married, you want to bear children.
Yes,
you wouldn't want
that
to.
is health issues
Yes,
also.
so you start seeing you're having health issues. You've forgotten in the past you've smoked, or you've taken this amount of, you know, maybe alcohol or this, you know, certain things that actually damaged a part of your organ that you didn't even know it's actually there.
It's
so
really
let's take some WhatsApp messages. We have
okay, so we have messages right now that we have for you. We'll start taking from this message here. It says, I am in support of the removal. Okay, sorry, I beg your pardon. Talking about cigarette, but cigar smokers face many of the same potential risks as cigarette smokers. So it's almost the same thing, including cancer. Now, chewing tobacco or smokeless tobacco products are not safer than cigarettes either. Now, smokeless tobacco contains almost 30 cancer-causing chemicals, which is a scary number, 30. And it also says that e-cigarettes, the vapes, yes, I was talking about these vapes, about these people taking this.
That's what like I said, the vape and the rest.
So an emerging form of nicotine delivery differ from traditional tobacco products. Now, vaping delivers more concentrated nicotine than cigarettes in a smokeless inhaled mist. I mean, we're talking about the vapor, a really scary thing. So health risks from the vape products range from asthma to chronic obstruction of pulmonary disease and cancer. A really scary one there. And also, I think this person ended with tobacco use harms every organ in your body. Exactly. Smoking tobacco introduces not only nicotine, but also more than 5,000 chemicals, including numerous carcinogens, that's cancer-causing chemicals, including and into your lungs, blood, and organs. Now, this person forgot to include their name and location, but definitely this is someone that when you see, you know that he is a health practitioner, someone that understands the effects of this smoking into someone's body, giving the detailed analysis of how much you're taking into your body. So these are things that you need to go back, check it, and ask yourself if it is worthy of you putting yourself in that kind of harm, putting your family in that state of concern, just because you want to just take, just relax. Because I think, what else does this thing do apart from making this thing happen? What else does it do, Fatima? Does it make you, the smoking? I want to even know how it.
So it depends on what you're smoking, right? Because I don't think the tobacco actually has any kind of thing that makes people. But then for those that smoke weed and other kind of, I think there's a way it makes them feel, because you see them misbehaving afterwards. So I can't really say what they actually feel, but imagine you going through a trauma or like distress, like I said, and then you just get addicted to smoking, and you smoke like 3 packs in a day, which has 20 sticks in each of the packs. And imagine a person smoking up to 65 sticks in a day, simply because they are heartbroken, or they lost a loved one, and they're hiding behind something that's why you see some people going in for liquor, some people going in for the smoke, some people going into eating. They just keep eating because they are depressed and all that. So it actually happens, people depressed, and they actually,
at the end of the day, you're taking something to your body that does not actually do anything for your body. It's not like it helps your organ grow. Instead, it destroys you. So it boils down to a lot of these people that you find in this kind of situation, telling you it's peer pressure and other things.
We still have more messages, WhatsApp messages. Let's see if we can take some of them. Kamis from Katsina, I think I remember Kamis, just Maya. It says smoking addiction can have many negative effects on a person's health and well-being. Some of these effects include increased risk in lung cancer and other types of cancer, increased risk of heart diseases and stroke, reduced lung function and respiratory problems. It's also a total waste of money. How can a sensible person use his hard-earned money to burn them? One thing that's becoming increasingly worrisome is how students are getting themselves in smoking weed and other things. Now that's exactly what we're talking about. Like it's becoming worrisome. It's like you go to schools, you see 18, 19-year-old getting into the university, and they form this group. We are the champions of the campus, kind of.
That's the most scary thing.
And then you get that influence. You get influenced by, if one person in that group is actually smoking, trust me, there will be a tendency of all the other people in that same group smoking.
And even if you don't smoke and you keep bragging, my friend is the one that does, and I cannot easily be influenced. You still
no, but there are actually people, but you inhale. So I think the best thing you do is, if you really don't want to, get anything that is going to be also detrimental to your health, move away from them when
that person, or if that person is really close to you, then find a way to convince that person to drop that habit.
To stop.
Because it's just a habit that is not good for your health. So it's something that could easily be dropped. I mean, if there is one thing we know, it's that majority of people, based on research, majority of people were influenced
by peer pressure.
Exactly, by peer pressure. Someone would just tell you that, if you're a big girl or big boy, you should do this. I mean, that's what the big people do now. A majority of people can relate to this. And if you have been to universities,
it's crazy because, like a couple of years, like I've gone for a field work and I've seen, like big married men surprisingly are carrying hookah inside their cars, where they find a place, they just sit down and just mix it with their friends and they smoke. That's shisha.
Yes, of course. It's now something that everybody sees it as normal.
And that's really worrisome,
that shisha thing. It got to a point where it's normal. Every party without it, it's not a party. And sometimes
they'll be asking, is there going to be this? Is there going to be that? No. Come and eat food and let's just pray and go home. We don't need all that.
These things are really bad and scary for us. All right, so there are more messages that we have. There is this message that says, the menace of smoking and its attendant consequences, especially amongst the youths, And sadly, teenagers is such that every aspect of society should be mobilized against this problem. Now, lung cancer is spiraling out of control. That is the most scariest thing ever. Its importation should be clamped down on. Now, this is something that one of our callers has pointed out, and the person says, I believe if the cost of cigarettes is such that it is 2,000% of what the market price is at the moment, the appetite certainly isn't going to such. Okay, so right now, what this person is saying is if they definitely clamp down on the importation, stop it, and then maybe just reduce a bit, and then it starts like getting imported a bit. Exactly. So when there is that amount, then the sellers of these things will now increase the price. So when you know, we all know when supply
so that
is
when
high,
it's high,
then the price
the
is
demand
high, and then
will be
people
low.
will not want to spend that whole money on these things. I mean,
and just like the last message we read, the person saying, how can someone actually spend their hard-earned money, you know, to
kill themselves?
Yeah, so,
exactly.
Hello, good morning.
Hello.
Good morning. Your name and location, please.
I'm Dr. Shehu Isa from Bauchi.
Oh, thank you so much, Dr. Shehu. I think you'll be the right person to tell us about smoking and its side effects.
Exactly. I've seen the topic of today is about smoking addiction. Yeah. First and foremost, I would like to thank all you staff, Leah and the rest, Ayuba, Elia, and all the rest of us.
Thank you so much.
I appreciate you, Doctor. Thank you.
The question of smoking addiction is it has a lot of implications, but most of our people nowadays is they have turned smoking into a habit of like they are taking it as an enjoyment or maybe relaxation. It turns back to them as an addiction. There are so many ways that they can bring that to an end, but the very fact is this: nowadays, more especially in my state, autistic, we have that cases. We are having a lot of cases. That smoking addiction leads to many people to numerous diseases like hepatitis, like liver cirrhosis, and the rest. So, for me, that is not a reason to become addicted. There is no reason for someone to become addicted to smoking. The reason is this: any human in this world, as we know, has been breastfed by his mother, right? Therefore, if you have been breastfed by your mother, and then there is a time that you are done with it, why can't you stop smoking cigarette or all these nicotine substances? More especially now in Bauchi State, I'm even documenting a special program for people so that I'll forward it to Trust TV about all these issues of smoking and drug abuse, because Bauchi State is now one of the states that has the highest number of smokers, highest number of drug abusers. More especially now, the cases that we are having at the hospital is women. Women are now seriously addicted into drugs. I can say in Bauchi State now, married women and young girls, I'm telling you, out of 100%, 60% of them are into drugs and hard drugs and smoking addiction.
That's a scary number.
Maybe their husbands didn't know, their relatives, their parents, women, they don't know. So I'm even documenting a special program for Trust TV so that I will forward it for them as a documentary so that they will enlighten people. And secondly, I would like to say with this smoking addiction that we are talking about can be prevented. There are so many ways medically that we give advice to patients or addicted people who are smoking. One of the advices that we used to give them advisably is, if you are addicted to taking smoking, you can reduce it There are so many ways of reducing it. There are people that will smoke in the morning, early morning, without even taking breakfast, they will start with smoking. There are a lot of people that they did not smoke like a packet of cigarettes in a day is a problem. There are so many ways of reducing it. One of the ways is if you're taking cigarettes like 4 in the morning, maybe 4 in the afternoon, 4 in the evening, you can reduce it to 3, 3, 3. Gradually, you reduce it to 2, 2, 2. Then gradually, along the way, you might reduce it to the nearest minimum, or you might even stop it. And the only option for addition of all these kind of things is, especially narcotic things, is for you to consult a physician. A physician will give you an advice. He will show you the side effects of doing that. I think that would be the best solution for people. But discussion, all this discussion, telling people if you're not a medical personnel, some will take it just for granted and they will continue doing it. But the most serious problems, Maya, now that I'm telling you, is what I'm documenting is drug addiction, more especially women now in Bauchi State. Are seriously addicted into drugs, more especially an injection we call pentazocine injection. Really all medical personnel know that pentazocine injection, yes. Married women, girls of 18, 15, you see them. I have been following them. I have been documenting the things. I have it. I have the record in my system. I have the videos there. The most serious, the most disturbing.
It is a sad situation, doctor, and of course, with the help of you and other doctors out there, of course, the necessary stakeholders, we hope that we're able to solve this particular menace. It's really a sad situation. But thank you so much, doctor, for calling in and pitching in, of course, your thoughts and guides on how to stay away from this. Is not, we are assuming that.
Yes, like you're highly welcome. You're highly welcome, and I wish you best well. And when it's ready, I will forward it to Trusted so that they will help us in people over the implication of it.
We'll connect with on that. We'll talk on that, yeah.
So, okay, so thank you so much. And let's get back to, you know, the discussion. One thing he mentioned was making a geographical example, you know, Bauchi State, and it's something that we all have known. I mean, maybe we've been just trying to go around the topic, but no, I have been to Bauchi, and I have seen the picture that he was painting. It's something that I can relate with. Yeah. Yes, exactly. I mean, when it comes to the northern part, it has become so deep. We're seeing it because maybe it's because we are from the north. We're seeing these particular things happen right before our eyes, and it is really scary, the numbers that keeps increasing. This thing, Fatima, has become normal. You know, the youth are thinking this is the right way to go.
I like the angle where doctor is looking at it, because we already know that, okay, men actually do smoke. If you travel out of the country, you'll be shocked to see an 8-year-old, 9, 10-year-old boy smoking on the street, and it's a normal thing for them.
I don't think it's normal there too.
It is not, like, it's a normal thing for them in that country.
I saw reports of you know, someone in the UK.
So it depends on which country,
complaining about the vape, the vape.
That's what I'm saying. It depends on the country.
Should not allow it.
So it depends on the country. When I mean smoking, I'm not talking about the vibe. I mean the tobacco, like the cigar they're smoking. You see, I'm telling you this because I've seen it actually. And you see them put it behind their ear. As young as they are, they put one here and they're smoking one. Don't think it's a joke.
That is the most scary thing.
And then, you know, the angle where doctor is looking at it, you know, focusing on women, because if you remember, it saddens me that women actually smoke. You know, like I said, we are the ones producing, and you're damaging your organs is actually not a good thing as far as I'm concerned. Bauchi, yes, because Bauchi is like a second home for me. And then we all know about the story of the Kasana the smoking, both men,
Yeah,
women,
there was
whole entire family.
Exactly. There was a time that
food,
narrative
the next day, I
was
think
passing, where they would say you enter a considered family and you'd see mother, father. But honestly, I don't really believe that. I don't believe that narrative.
We are going to continue this discussion because we still have sports updates coming up. So let's.
Okay, of course. Well, this is of course much that we can take. We were hoping that that we would get to take more the calls from you, but the people that were able to call to share in deep thoughts, exactly, we appreciate you. Doctor gave a tip of if you want to stop, since you're already addicted, then you need to at least manage the numbers and how frequent you used to. Just start managing yourself quickly, because it's really hard to stay away from something that you're really addicted with, but you can do it. It's possible. So please, let's head to that advice, and if you have somebody in our family that we need to help on that, also you can help use that tactics. And of course, a suggestion to the federal government on how to reduce the number of these things being imported into the country is also another great thing.